1 in 6 US adults binge drink about 4 times a month, consuming around 7 drinks per binge. This leads up to a staggering number of 17 billion drinks annually per adult. Some epidemiological studies support the fact that some alcohol can be good. Light to moderate drinkers of alcoholic beverages, characterized by having 1 to 4 drinks, have 20 to 40% lower mortality rates than non-drinkers or heavier drinkers. However, binge drinking can be detrimental. The CDC defines binge drinking as 5 or more drinks for men and 4 or more for women in about 2 hours. 16% of hypertension cases in the US are a result of excessive alcohol consumption. What is hypertension? Hypertension is increased blood pressure. Chronically elevated blood pressure can be a risk factor for many health complications, such as stroke and heart attacks. Now let's talk about how this happens. Starting with the central nervous system, it was found that ethanol increases excitability in the CNS, which leads to high blood pressure. Alcohol impairs baroreceptors, resulting in lack of sympathetic nervous system control, and therefore an increase in cortisol-mediated SNS activity, thus causing higher blood pressure. Endothelium can also be damaged by chronic alcohol consumption. This prevents endothelium from releasing vasodilative factors such as nitrous oxide, which decreases blood pressure. This is not well understood. Research suggests that alcohol leads to a shift from extracellular calcium to intracellular calcium, causing increased sensitivity to vasoconstrictive factors like norepinephrine, causing elevated blood pressure. Chronic alcohol consumption also increases one's risk for developing cardiomyopathy, which has poor prognosis of only 2 years and can lead to heart failure. Chronic alcohol consumption literally poisons the heart and can be associated with many cardiac diseases. One heart condition that can develop as a result of chronic alcohol abuse is cirrhotic cardiomyopathy, where cirrhosis and scarring of the liver affects the cardiovascular system by elevating liver enzyme levels. The immune system can be affected by alcohol consumption as well, as ethanol alters lymphocyte function. Research has shown that immune suppression as a result of alcohol increases risk for myocarditis. Dilated cardiomyopathy causes impaired contraction and lower ejection fraction due to left ventricular thinning. Lastly, atrial fibrillation can develop as well, causing irregular and rapid beating of the atria, which increases the risk of heart failure. Some of the diverse underlying mechanisms that contribute to alcoholic cardiomyopathy, including myocyte loss, mitochondrial disruption, and impaired calcium handling. Stroke, which is abnormal blood delivery to brain tissue, can be influenced by alcohol intake. Binge drinking in one Finnish study was associated with 1.99 times the risk for ischemic stroke and 1.85 times the risk for total strokes compared to non-binge drinkers. As examined, alcohol increases blood pressure, which itself is a risk factor for stroke. Chronic binge drinking is also associated with cardiomyopathy, which can contribute to the formation of arrhythmias and heart failure, which is a stepping stone for stroke. Abnormal lipoprotein composition and lowered high-density lipoproteins caused by binge drinking also promote atherosclerosis, which impedes blood flow and can lead to stroke. Binge drinking also induces increased platelet aggregation, thromboxane, and clotting factor formation and release, and decreased fibrinolysis, especially in withdrawal periods. These changes in biochemistry can also promote stroke. So the next time you go out celebrating with your friends, try to tally your drinks. For more information about alcohol's effect on the heart, see www.drinkaware.co.uk or Glenn Pyle's lecture notes. You can also go to your local physician if you have any questions regarding your heart health.